Hey guys, welcome back to allornonelaw. Today I'm gonna talk about quick pediatrics, and today's topic of discussion is juvenile juvenile Graves disease. Graves disease. I'm gonna talk very briefly about this, and very important for board examinations. Okay, guys. So remember this Graves disease. You know very well the Graves disease is nothing but it's hyperthyroidism state, right? Hyperthyroidism where the hormone level T4, T3 are are raised, are more than normal, right? So hyperthyroidism. So it has a triad known as hyperthyroidism, hyperthyroidism, okay, with with diffuse goiter diffuse goiter, and the patient will have ophthalmopathy, okay, and dermopathy. It's nothing but involvement of the skin. Let's see how it involves the skin, okay, pathy. So very important triad you should know, that's hyperthyroidism with a diffuse goiter, ophthalmopathy, and dermopathy, okay. So let's talk about the etiology. What is the cause for this juvenile Graves disease? The immunogenetic disorder with thyroid stimulating immunoglobulin. So in a previous video we have uploaded the synthesis of thyroid and how it is transported and how it is released into the blood. That's really very awesome video. Just what you call search in YouTube and try to watch that video by allornonelaw. So and it has another one important is anti-thyroglobulin antibodies, okay, anti-thyroglobulin antibodies, and another one is anti-microsomal antibodies, okay. Then we have thyroid stimulating receptor antibodies, TSH receptors. These are really very important, guys, antibodies, okay. So anti-thyroid thyroglobulin antibodies, antimicrosomal antibodies, TSH receptor antibodies, okay. So let's talk about the sign and symptoms. Sign and symptoms. So while these patients will not have sudden onset, it will be a gradual onset around 6 to 12 months. 6 to 12 months, okay. And they will have what you call, as you know, they will have increased appetite, okay, and the weight will be normal or low. Though they have increased appetite, the weight will be normal or either a low. They will have the fatigue, myopathy, sorry for that, okay, and increased sweating. These are signs of increased BMR, right? Basal metabolic rate. Fine tremors can be seen. Goiter is really very important physical finding. Heat intolerance, whereas you see cold intolerance in hyperthyroidism, heat intolerance. Okay, exophthalmos is nothing but protruding of the eyes. Okay, as if it looks they are staring at us. So exophthalmos. And the in female patients you see menstrual irregularities. Okay, so sometimes they say the cycle is of 28 days, some say the bleeding has increased, and some says and some other months the cycle changes to 30 days. Okay, 26 days, some keeps on changing, right? So menstrual irregularities. And thyroid storm is really very important. In the thyroid storm you see hyperthermia, the severe body temperature is raised. Okay, severe tachycardia leading to cardiogenic shock. Okay, tachycardia, the patient will undergo the severe tachycardia. Okay, and other thing is that they will have a CNS manifestations, central nervous system manifestations. Okay, in the form of seizures like. Okay, so what's the lab findings? The lab findings, you know very well, the T4, the T3, okay, are elevated, right? The TSH will be low, right? The TSH is low. So, and the other thing, this is seen in most of the hyperthyroidism cases, right? So if you measure the TSH receptor antibodies, then you find it. Okay, so their antibodies are raised. Okay, so what's the treatment for this? The treatment for this is you can give what you call a propyl thiouracil, propyl thiouracil. Okay, around I think 5 to 10 milligram per kg per day, q 8 hours per orally, but don't try to remember the dose, it's not important for your civil examination from it. Okay, and a propranolol can be given to minimize the tachycardia. Okay, and if at all it doesn't subside, then you can go ahead with the thyroidectomy. Okay, the complication of the thyroidectomy is one of the complication important is you can remove the parathyroid gland along with the thyroid, so they can have a hypoparathyroidism also because of that. So that's really very important. Okay guys, so thank you so much for watching this video. Take care.